The Linking Systems of Care for Children and Youth, a demonstration project funded by the U.S. Department of Justice, Office for Victims of Crime, is designed to support the work of statewide initiatives as they promote healing for victims of crime by developing and coordinating trauma-informed prevention and intervention services for all children and youth and their families. Linking Systems of Care is demonstrating change in 4 states that are remarkable in the strength of their statewide collaborations, diversity of youth populations and stakeholders, and long-term commitment to modeling change.
I think probably the best advice I could give folks in the future would be to start with conversations with larger organizations that see more youth at one time. So we did start in a school district, but it was a small school district, and sometimes it seems like it's easier to start small. But I think we have the capacity with the team and being connected to the Board of Crime Control and the Youth Justice Council, which is a sub-council of the Board of Crime Control, to reach out to larger partners. So maybe if we had reached out a little sooner to the Office of Public Instruction, which oversees all schools, and maybe got some buy-in early on, that it doesn't hurt to maybe go big and kind of start there. Additionally, I think it would have been helpful to start with organizations that are across the state. So for instance, I'll use again an example of a Boys and Girls Club. A Boys and Girls Club might be specific to a community, but they're also a statewide organization. So if you can get them in and them interested, they can help you sell that and tell others how important this program is and what this program has done for them. So kind of using organizations that also have a statewide reach, I think would give a little bit more avenue to move the project along more quickly.
And the one word that continues to come up and with me is patience. And I go back to, if someone would have told me 3.5 years ago that it would take 3.5 years to be at a point where we're actually implementing the screener, again, particular, and not piloting anymore and not researching it anymore, that it would have taken that long to get through all of that.
Knowing the problem. So it took us a long time to really understand what the problem is that we were trying to address. Taking that time up front to understand that we don't know what we don't know. And until you talk to the people on the ground, you're not going to. And so you really need to be involved with your communities, your service providers, even families that are experiencing trauma and trying to find services. Otherwise, you have no idea what you're fixing. And you may end up fixing something that didn't need it. Certainly, I would tell myself to adjust my expectations about what's going to happen, and one of those would be having underrepresented populations involved. And knowing your limits, this was a big one for me. We started out, really wanting to do these big, great, grand things that's just going to change the way everything happens, and we had really good intentions. But we had some funding. That doesn't mean that we have millions and millions of dollars to create new jobs, new resources. We don't have the money to fund the ones that are out there. We can't, change the distance between providers. We can't, there's a lot of things we just physically cannot do that, yes, we need to do to improve what's out there, but we're limited. Being able to understand what you can work within your parameters. So there's things that we can do, like we developed this resource guide. So there's not a lot of resources in Eastern Montana, but here's a complete list so you know what is there, because a lot of folks didn't even know it was in their own communities. And so I think knowing your parameters and what you can do within them. The Connect system is another one that's statewide that we were part of now. And so that really provided that continuum of care. Cost us almost nothing, but we did find funding to support communities to bring the Connect system into their own offices. And so little things like that, huge difference, because now that program operates across the state. That's another one of those what would I have told myself moments, is making sure that there is more involvement from those folks in the communities. We had a lot of folks involved who were service providers on the ground, boots on the ground in communities. We had a lot of the government folks and policy folks involved. We didn't have a lot of folks that were actually experiencing it involved, and I think that was a huge miss. It is difficult to get them involved, but if I could go back to the beginning, I certainly would have tried harder and put more energy into developing, I would hesitate to call it a survivor group, but a group for folks who had been through it, experienced it, want to improve it, and are willing to speak out.
I think that maybe having clear recognition of some of the obstacles, some of the barriers, maybe just having more realistic expectations of how many youth would be able to screen, how quickly we'd be able to start doing that, and the barriers that would be there, both within organizations who would be adopting the tool, but also at the individual level, once an organization adopts a tool, the youth needs to consent to it, or the parents do.
I think a big part of it is just to keep on mission. I mean, we all have the same goals. We all want to make sure that kids grow up in a healthy environment and that they have the support, they and their families have the support they need. None of us like victimization, so we all have the same mission, and to really just stay on mission and keep repeating that mission over and over again. And that's been the most effective strategy for me, is just to keep saying, this is a really exciting time for us. We have a chance to change the paradigm. This is a cultural shift, and to kind of get into that loftier language. And I think that's really been the most effective strategy for me going forward.
I think if a community has not had a lot of education about childhood trauma and adverse experiences, I think starting there to help people understand what the need is really important. And then these tools move really nicely from there. And I do think listening to concerns, showing the data that has been compiled about people's comfort levels and giving the screening, and two, all the information that has been gained from doing the screenings, I think speaks for itself. And then I just think listening to what the concerns are and being as flexible as possible while maintaining fidelity to the tools.